An interesting fact which has emerged recently is that the death rate from major operations like removal of cancer of the pancreas have fallen in the last 15 years from about 10% to 2% in the best hospitals. But why has this happened? Well, it has happened not because the number of complications has come down, but they've been detected earlier and managed better. And this is the reason why we have done this book. Now, the other reasons why the mortality has come down is that people now measure complications better, and our previous Sixth Gyan Burman Oration speaker has been at the forefront of saying how you would estimate the seriousness of complications, the grading of complications. And the third maneuver is that instead of having a lot of different hospitals performing difficult procedures with widely varying death rates, our speaker tonight, Dr. Guma, has been at the forefront of saying that all these major procedures should be centralized in central areas with surgeons and our large volume hospitals. And finally, the death rate and the complications can be reduced if one has checklists before, during and after operations. And all you do is to check whether it's the right patient, it's the right side being operated on, and this has reduced the complication rate by about 30%. Now this and many other reasons have been why we have done this book. We start by a general introduction of the complications and how they affect the kidney, the lung, the heart. Then we go on to institutional problems, like what to do with complications, how to manage them in areas where there are limited resources. And finally, we look at different areas of the GI tract, gastrointestinal tract, like the gullet and the rectum and the pancreas, and look at how to manage complications after operations on those areas. Now, after doing this, we invited all the leading experts in the world, my co-editor more than I, who knew them personally, and we got most of them accepted. And we have got together a major book on how to manage complications, which we hope will be of value worldwide, and we think that it will be a major reference book for the future.